What's up, you guys? This is your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering how hard it is to communicate with doctors at the hospital as an X-ray tech. So, to give you context, I'm a night shift X-ray tech, been doing it for over 4 years. Work on godly amount of overtime, so I dabble in both day shift and night shift. So, as far as communication, I know that more if you're a student or if you're new to the field, communicating with doctors is kind of intimidating because it all really depends on who the doctor is. And not to be mean, but sometimes, depending on where you work at, the doctors have thick accents. They're, from different places. Even saying their name sometimes is hard. So just putting that out there, because there's many times where the doctors will be telling me stuff, and like all I'm trying to understand is, do you need a chest? Do you need a KUB? What imaging do you need? What are you trying to see? Sometimes I'm just like looking for keywords, because some people, it's not their fault. They just have a thick accent, and that's like one of the more harder aspects. Other places, you'll have like the most chillest doctors. You can go up to them, be like, hey, and you can communicate with them like it's just another dude, and it will be super easy. And then other doctors, they will try to intimidate you with big medical words, and then you're just there like, is that a chest? Is that a KUB? What are we trying to do here? Or sometimes you'll shoot at images, and they'll be asking you questions over the X-ray, and then sometimes it's a little bit of a struggle. But that's more for like, can't confirm or deny naps on the night shift, and my brain still hasn't fully, set in. Or during night 7, when your brain's kind of foggy because you've been working 7 nights straight, and it's more harder to communicate. But think that's just more of a Miguel problem than with other people. But for the most part, it's not really that hard. I know residents go a little bit more harder on the proper medical words and all the proper terms, but then again, they're just student doctors or trying to impress their resident who they're under or whoever. And it's a little bit more harder to communicate because they'll throw you other words and they won't know how to explain what they're trying to see. Or they'll describe the problem, the disease the patient has, and then they'll look at me and I'm like, so is that like a chest? So are you good? Do you need another picture? So sometimes there's somewhat of a, like, it's a little bit not as easy to communicate. But I do know that it doesn't compare to like the nurses. The nurses have to interact a lot with doctors. We don't really deal much. As long as like you get the order, you look at it, everything seems about right, and you shoot the X-ray, that might be the most amount of non-communication you deal with the doctor. Sometimes they'll just come up, look at the images, and they'll be like, and that's it. Other times they'll sit there and they'll ask you to invert it. They'll ask you to make adjustments. Can you darken it? Can you do this? Can you do that? Or whatever. And it won't be that bad, Or they'll ask you about the radiologist, or they'll be asking you questions about why certain stuff didn't get read on the report, and you're like, it's the radiologist, not me. It's there. So, Or maybe if you order this, you can see that. So there is that kind of aspect to our profession, but it's pretty chill, especially the emergency room doctors that you deal with a lot, or even the doctors on the floor at our hospital. You kind of go through a little cycle, and you already kind of know what to expect. As soon as people get admitted, you see the same stuff happen over and over and over. So you already kind of don't even have to communicate as much, or you can know that maybe certain doctors are more picky with their images, so you can maybe do a little bit better or adjust it, or already kind of have a set standard to know how. I do know that ortho doctors or surgeons are a little bit more picky than the other doctors are. Because the emergency room doctors, it's like, you shot it. Good. Not my problem. Yeet it off to the ortho or yeet it off to the cardiologist. And then the cardiologist will be like, we need another one. We need this. We need that. And they'll be more nitpicky as far as all the imaging and stuff like that goes. But overall, it's not too bad. I know in surgery, it could get more hectic over there because they're wearing masks or gown. And it could be a little bit more of a challenge sometimes over there. But overall, it's not too bad. So, this has been your boy Miguel. We'll see you on the next one.